for the diet, size, screen time. This is most important. Thank you.
Very good afternoon to everybody. Today I will talk about dietary management of patients with compensated cirrhosis with obesity, sarcopenia and diabetes. सब कुछ कवर कर लिया गया है, मुझे सिर्फ रिपीट करना है, रिमाइंड कराना है आप लोगों को. So definition of compensated cirrhosis is already talked with the previous speakers. It has no symptoms, no ascites, no portal hypertension, no varicose hemorrhage, no hepatic encephalopathy, and no jaundice. Causes of nutritional deficiency in compensated cirrhosis is reduced intake, nutrient loss, malabsorption, and altered metabolism. So the main thing is dietary principle of compensated liver cirrhosis with obesity and diabetes. When the patient is obese, which we are discussing about, for instance, morning, obesity and diabetes causes worsen the liver cirrhosis. So it is better to decrease or to make the dietary management very nicely. So calorie requirement or calorie intake should not be more than 20 kilocalorie per kg of ideal body weight. As Shilpi madam has already talked about the ideal body weight, how to calculate the ideal body weight. So anybody can tell me ki, if the patient is coming to you, how you are calculating the calorie for liver cirrhosis or diabetes or obesity? Any of you? Or you are following the written instructions by the doctors? Can anybody tell? Not. Yeah. So. Exactly.
As per your opinion, as per your assessment, how much calorie they require. So always don't follow the doctor की कहते हैं 3,000 तो बस लिख के ले लो. वो 3,000 कितने दिनों में अचीव करना ये भी मैटर करता है.
That is very important point. How to give the calorie, how to increase the calorie and how to decrease the calorie. So 20 kilocalorie per kg of ideal body weight for diabetes, obesity and diabetes. Some diabetic patients may be obese and some may not be obese. So 30 kilocalorie per kg of ideal body weight is required. And the person, if is having diabetes with obesity, it should not be more than 20 to 25 kilocalorie per kg of ideal body weight. Protein should not be less than 1 to 1.2 gram per kg of body weight. And fat should be 20% of total calorie. And as we are discussing about the carbohydrate, the major part of our diet is carbohydrate. That should not be more than 55 to 60% of total calorie. Classification of BMI for normal range of ASEAN is 18.5 to 22.9. 24.9 वाला कौन लोग अभी तक यूज कर रहे हैं? प्लीज अब 22.9 हमारा जो नॉर्मल BMI है उसको हमें यूज करना है फॉर ओवरवेट एंड ओबेसिटी grade 1 and grade 2. Similarly, we have to follow the instructions for the calorie also. Weight loss strategy in liver cirrhosis is very low calorie diet, that is 800 kilocalorie per kg per day is advisable under the supervision of 6 to 8 weeks. Under the supervision means if the person is coming to you with morbid obesity, then 800 kilocalorie to 1000 kilocalorie per kg, 1000 kilocalorie diet can be prescribed, but with the proper supervision so that patient will not feel fatigue or dizziness or some any other symptoms. So when you are prescribing for the patient, give your number or get connected with that type of patients. Adequate amount of protein, be ensured to provide the protein, carbohydrate plus protein combination, and it should not be less than 1.5 gram per kg of ideal body weight. Adequate micronutrients. It may require supplements because the calorie has reduced. It is 800 to 1000 kilocalories. Fiber should be maybe required to supplementation, and free food should be included in the diet to avoid constipation. Adequate fluid after assessing edema, ascites if present, not because of liver cirrhosis only, due to some other reasons like renal impairment or other reasons, there may be edema or ascites. So we have to look for the ascites. Inadequate food knowledge, preparation skill, and food insecurity can impact the dietary intake. How to prevent the complication of the disease? क्या होता है कि जैसा अभी ममता जी ने बताया कि हमारे पास कभी कभी समय नहीं होता है, कभी कभी हमें पता ही नहीं होता है कि हमें क्या खाना है. So we as a dietitian have to aware to the general population also for the requirement and what are the nutrients available in the locally available foods. So it is good or it is advisable to make aware to the patient and the family members also. Family counseling is very important in liver cirrhosis or any other disease. So कि जैसे हमारे पास पेशेंट आते हैं बोलते हैं कि हमने बोला कि नमक खाना है 3 ग्राम, मैडम सबसे कम नमक खाता हूं, मेरे यहाँ कोई खाता है तो कहता है कि कम नमक का खाना है. सो देयर इज अ डेफिनेशन ऑफ कम नमक, दैट इज 3 ग्राम पर 3 ग्राम से ज्यादा अगर नमक ले रहे हैं तो वो ज्यादा नमक होगा या कम नमक होगा. तो कम नमक की परिभाषा वी हैव टू टीच एवरी टाइम. कम नमक में 3 ग्राम नमक के साथ साथ जो हमारे पैक्ड फूड या जो हमारे प्रिजर्व फूड होते हैं उनको भी उसमें से हटाना होता है, बिकॉज सोडियम कंटेंट उन सब में ज्यादा होता है जिनको बिना देखे अगर हम खाना शुरू कर देते हैं. एक बिस्किट खा लिया था मैडम और कुछ ज्यादा नहीं खाया था, बट एक बिस्किट में कितनी कैलोरी है, कितना फैट है, कितना सोडियम है, कितने क्या प्रिजर्वेटिव्स यूज हुए हैं, दैट इज वेरी इंपॉर्टेंट. सो व्हेन you are taking the diet history of the patient, it is very important to ask about these things also. How many biscuits, how many times you have taken the dal mot? एक चम्मच दाल मोट contain approximately 50 to 60 calories and approximately 2 to 3 gram of salt. So it is very important to talk to the patient regarding the food and food choices. Medical nutrition therapy of cirrhosis with diabetes. When patients are coming with the diabetes or with any other comorbidity, diabetes with cirrhosis, the medical nutrition therapy is very important. The first step is medical nutrition therapy, that is lifestyle modification with dietary modification in that in daily routine. So some patients may require oral hypoglycemic index and some patients may require insulin also. So insulin or OHA, in both situations medical nutrition therapy carry forward. मरीज कहता है कि हमने इंसुलिन लगा लिया, अब हमको डाइट में क्यों फॉलो करना है, बट वी हैव टू टेल एंड वी हैव टू आस्क कि how much you know about the diet or how much you know about the insulin, and every dietitian should know the insulin, how insulin is working. If there is, can anybody tell, anybody knows about the insulin? Yes, tell me what type of insulins we are using. Good. So anybody else, how it works at SGPGI intern, please tell how short acting insulin works. What is the hours, how many hours it works? It is very important for each and everybody. One should know कि जो खाना आप दे रहे हैं वो कितनी देर तक डायबिटीज को प्रभावित करेगा. So what type of food you have to give to the patient, to give to suggest to the patients. So complex carbohydrate, हमारा ज्यादातर खाना carbohydrate rich है, हमारा ज्यादा पार्ट खाने का carbohydrate होता है. So when you are going to prescribe a diet, so there should be combination of carbohydrate plus protein plus fat. So protein से क्या होता है, प्रोटीन से क्या होता है when we are giving to the diabetic patients? हाँ, if we are giving for the diabetic patients, yes, please tell. Why? Yes. बिल्कुल, बिल्कुल सही. इसके साथ साथ प्रोटीन जो है हमारे शुगर को बहुत तेजी से बढ़ने भी नहीं देता और घटने भी नहीं देता है. तो एवरी टाइम when we are prescribing a diet, we have to suggest a night time snack or night time protein rich food so that patient will not get the nocturnal hypoglycemia. Actually for should I answer? Actually for all type of general population there is a concept of this. Breakfast should be protein rich, bedtime snack should not be protein rich. So there should be all the food, whatever we are eating, whatever we are having, it contains protein and carbohydrate. So there is no issue of digestion in during हम सो जाएंगे तो digestion नहीं हमारा प्रभावित होगा. So you can give like dahi, दूध या custard या खीर sort of thing, so that patient will not get the nocturnal hypoglycemia. Okay, so protein is very important for liver cirrhosis patients. Polyunsaturated fatty acids, monounsaturated fatty acids and omega-3 fatty acids, हर मरीज बादाम जरूर खाता होगा. So tell them कि yes, 2 to 4 pieces of badam and akhrout can be added in the diet, but it should not be like Archana madam has already, Archana Dwivedi has presented पूरी मुट्ठी भर के dry fruits नहीं खाना है. There should be numbers, because 10 badam if you are taking, it means कि you are taking 10 gram of dry fruit that contain approximately 50 to 60 calories. So it is very important when you are going to eat any dry fruits, you have to count. You have to tell in the counting. Sources from complex carbohydrate, छिलके वाली दालें, चोकर वाला आटा, all these things we have already discussed. So I will skip the slides. Simple carbohydrates should be avoided. चीनी, मिठाइयाँ, गुड़, शहद, गन्ने का रस, फल का जूस नहीं लेना चाहिए. One has presented like fruit juices or fructose should be avoided. Fruit in form of fruit juices definitely for diabetic patient or for liver cirrhosis or compensated or decompensated liver cirrhosis, it should be avoided because it contains no fiber, as well as it will increase the blood sugar, rise the blood sugar immediately. So it is better to take whole fruits So some fruits which increases the blood sugar, that is आम, अंगूर, केला, चीकू, इन फलों को भी हम खा सकते हैं. बट इनको हम पेशेंट्स को मोस्टली कहते हैं कि कम खाइए, नहीं खाइए. क्यों? क्योंकि बाल्टी भर के आम खाते हैं, मुट्ठी भर के अंगूर खाते हैं. So if you are going to tell them कि yes, you can take the mango, but half slice of the mango, that will not increase the blood sugar and that is not going to affect your blood sugar if you are taking in exchange of one fruit, and the person and the patient will get the satiety and the satisfaction also that I have got the chance to eat the mango in spite of having diabetes and liver cirrhosis. So I was talking about the carbohydrate. So do we restrict at all the sweets? Do we restrict all the sweets? Can anybody tell from the audience? No, we should not. Exactly. सबसे पहली बात है कि अगर हमने बंद कर दिया तो भी खाएगा. और जो ये छोटे छोटे हमारे जो वी आर लिविंग इन इंडिया ना, वी हैव सोशल गैदरिंग, सोशल फंक्शंस आल्सो, कि हमारे यहाँ बर्थडे है, हमारे यहाँ पार्टी है, एक ही खा लीजिए, एक खाने से क्या जा रहा है. दीज आर द प्रैक्टिकल इश्यूज विद द पेशेंट. आप पेशेंट से जब बात करेंगे उनको बोलेंगे नहीं खाना है. वी हैव टू रिस्ट्रिक्ट चीनी, इट्स नॉट रिक्वायर्ड, बट स्वीट्स डेफिनेटली इट हैज low glycemic load if you are taking in a small amount. So glycemic index and glycemic load plays a very important role in managing the diabetes. Glycemic index means how much the blood sugar will be raised by the food product. आम का glycemic index बहुत ज्यादा है, तरबूजे का glycemic index बहुत ज्यादा है, but the glycemic load of these foods products are very less. Ice cream ka glycemic load is very less. Anybody knows it? Yes, because it contains fat, it contains protein. So it is better if you are going to prescribe to the patient, you can give the options for once in a while, not for every day, because आज नहीं तो कल वो आपका sugar बढ़ाएगा ही बढ़ाएगा. But for the social gathering, definitely you can advise to the patient for these things also. And if the patient is compromised, patient is not able to eat properly, they are not having the good appetite, then if you give them more options, they will be happy and they will follow your dietary instructions very nicely. So glycemic load is glycemic index into carbohydrate is divided by 100. एक किलो तरबूजा खाने की बजाय अगर हम 100 ग्राम तरबूजा दे रहे हैं, 100 ग्राम तरबूजे का ग्लाइसेमिक लोड जो होगा वो 3 होगा. That is not going to affect your blood sugar at all. So 1 cup, जो अर्चना मैडम ने कप का साइज दिखाया था 150 ml वाला, अगर उतना कट करके तरबूज पेशेंट खा रहा है तो उससे पेशेंट का ब्लड शुगर नहीं बढ़ेगा. And it is good to give these type of advices to the patients. whole grains and cereals, whole pulses, legumes, all types of vegetables, green leafy vegetables, all type of fruits, milk and milk products, non-veg food, non-vegetarian food. क्या हम लोग ऐसा करते हैं कि मीट कोई खाने वाला पेशेंट उसको बोल दे कि बिल्कुल नो मीट? Yes. Meat itself doesn't contain much fat, but it contains, when we are cooking methods are very bad in our scenario. So we have to tell to the patient कि आप उसको steam करके खाइए या barbecue कर लीजिए या roast करके खाइए. Then meat is also not very bad. It contains very good amount of protein. Yesterday I got a patient that has height is 171 centimeter and weight is 101 kg. The ideal body weight was 64 kg and his age was approximately 56 to 57. बाबा जी कहने लगे कि मैडम ये खाना जो आप बता रही हैं इसको खाने से मेरा कुछ होगा नहीं, मैं ये नहीं खा पाऊंगा, इतना कम खाना नहीं देना है. तो मैंने उनको कहा कि आप जो खाना खा रहे हैं, whatever, if he was taking approximately 4 chapatis, so gradually he has to reduce the amount of carbohydrate, cut down the carbohydrate. It has to be replaced with the milk, dahi, mattha, paneer, and should be included free foods in the diet so that patient will feel the satiety and decrease, gradually he will decrease the intake of food. Sarcopenia, as already discussed in sarcopenia condition. So protein, the calorie intake should not be less than 35 to 40 kilocalorie per kg of body weight, and protein 1.2 to 1.5 gram per kg of body weight, fat 20 to 30%, and carbohydrate 60 to 65% of total calorie. Sources of protein, vegetable and animal sources, as already it has been discussed in previous lectures. Fats, polyunsaturated fatty acids and monounsaturated fatty acids along with the omega-3 fatty acids. So badam agar khata hai to usko mana nahi karna hai, definitely you can give, but it should not be handful. Individualized diet prescription should be provided to all patients with cirrhosis for frailty or sarcopenia. Reassessment of nutritional intake should be repeated at regular intervals. If clinical deterioration or lack of improvement occurs despite target calorie and protein intake, other causes should be considered and the nutrition prescription should be refined. बार-बार डाइट चार्ट बदल भी सकते हैं. कभी उसको हम बोल सकते हैं कि आप सॉफ्ट डाइट खा लीजिए, कभी लिक्विड डाइट ले लीजिए, और कभी आप अपने पसंद का भी खाना खा लीजिए. So it should be, हमको ये पता करना है कि why patient is not eating. If not eating, उसको ऑप्शंस चॉइसेस बदलने की जरूरत है. Eliminate alcohol and smoking. Daily walking 45 to 60 minutes is advisable and recommended and necessary. सूर्य नमस्कार, योगा और meditation. Meditation is very important. नींद नहीं आ रही है, बीमारी है, डायबिटीज हो गया है, सो इसके लिए क्या करना है? हमें मेडिटेशन करना है, कुछ देर योग करना है, जिससे कि हम एक अच्छी नींद ले सकें और एक अच्छा लाइफ स्टाइल, एक अच्छा जीवन ले सकें. Methods to improve immunity with the balanced diet, with stay hydrated, de-stress yourself, do exercises and balance sleep. I have already spoken at avoid. हाँ, for diabetic patient fasting नहीं रखना है, बहुत लंबा गैप नहीं रखना है. Small frequent meals, 3 major meals and 3 snacks to minimize nocturnal hypoglycemia. Bedtime snack is necessary. Choose low glycemic index food. Avoid smoking. Increase fiber rich food. Avoid fruit juices, fresh or packed. पेशेंट बोलता है कि मैडम वो डब्बा बंद जूस का है, शुगर फ्री है, शुगर फ्री जूस लिया है. नो, वी हैव टू टेल देम कि इस शुगर फ्री जूस से एक तो आपका फ्लूइड बढ़ेगा, दूसरा फाइबर नहीं आएगा. सो इट इज, जो उसमें इटसेल्फ जो शुगर है वो आपके ब्लड शुगर को बढ़ाने के लिए हेल्पफुल होगा. अचीव हेल्दी लाइफ स्टाइल, टेक अप्रोप्रिएट स्लीप. फूड एंड न्यूट्रिशन टिप्स, as everybody has already spoken. Thank you so much.